I feel like I've got my life back, and I am so excited you can't even imagine.
Took 13 treatments, and then instead of walking 1 block with angina pain, I could walk 3 miles per hour.
After 16 treatments, my pain was completely gone.
After 3
the angina was just gone.
The races. I had no more problem. And they told me I'd never work again, and the day after I got home, after the first 10 treatments, I went back to work again.
Has saved my life and saved me and my family a lot of aggravation.
Perhaps no other treatment in the history of medicine has generated such strong opinions as chelation therapy. The majority of physicians still view this as nothing more than quackery. Yet, in spite of this opposition, chelation therapy continues to gain widespread public support among the millions who have personally experienced the benefits of this remarkable treatment. Part 1 of this video will help to explain in simple terms what chelation therapy is and how it works scientifically. In Part 2, patients who have taken this therapy tell their own stories about what chelation has done for them. Chelation therapy is a treatment given intravenously under the supervision of a thoroughly trained and licensed medical doctor. Just prior to the treatment session, a registered nurse prepares the intravenous solutions. The ingredients in each patient's intravenous container are introduced in a sterile fashion using all disposable supplies. The dosage of the ingredients are individualized for each patient, according to the patient's height, weight, age, sex, and kidney function blood test. Once the patient arrives to the clinic, a tiny intravenous needle is placed in the hand or arm. The patient is then escorted to a comfortable recliner chair where they relax while the solution is slowly administered over the following 2.5 to 3 hours. A computer-controlled pump is used to ensure that the solution is dripped into the vein at a carefully prescribed rate. All of these exacting procedures are used to ensure that the treatment is given with the utmost of safety. Serious side effects from chelation therapy are extremely rare. In fact, as long as chelation therapy is administered according to proper protocols, statistically speaking, the treatment itself is probably even safer than the trip to the clinic in a car. The chelation solution contains several important ingredients: EDTA, magnesium, vitamin C, and B vitamins. Each ingredient is important, and each plays a role in the effectiveness of the chelation treatment. EDTA, or ethylene diamine tetraacetic acid, is a synthetic amino acid which has been used for over 40 years to treat poisoning with lead and other toxic metals. When dripped into the bloodstream as an intravenous treatment, it circulates throughout the body like a non-toxic detergent, cleansing away calcium deposits in hardened arteries, as well as toxic metals and accumulated iron in tissues and organs. Once EDTA has captured the calcium or metallic waste, it circulates throughout the bloodstream until it exits the body through the kidneys. Having a chelation treatment is almost like having a shower on the inside. The other ingredients, magnesium, vitamin C, and B vitamins, are all used to increase the cleansing properties of EDTA, thus making the treatment more effective. Chelation therapy is known to work through well-understood scientific principles. In fact, this treatment helps to address some of the basic reasons why we develop chronic illnesses later in life. Clearly, one of the most important medical breakthroughs of this century was the discovery that most diseases related to the aging process are caused largely by an overabundance of toxic substances known as free radicals. As we will soon see, chelation therapy reduces these damaging free radicals more effectively than any other treatment currently available. Here is a common example of free radical damage. A fresh apple is cut open and exposed to the air. In a few minutes, the apple turns brown from free radical damage. Damage caused by free radicals requires oxygen and is known as oxidation. Because our bloodstream is full of oxygen, free radical damage takes place very readily through the process of oxidation. Free radicals are molecules which have undergone changes making them highly unstable. This cartoon illustrates a stable molecule. The two wheels on this cartoon molecule represent electrons spinning around the outermost part of the molecule. A molecule with all of its electrons in pairs is stable. However, if the molecule loses an electron, it becomes unstable. This molecule is now a free radical. It is so unstable that it will spin around until it collides with some other molecule, causing damage in the process. Three things are necessary to make a free radical: a stable molecule, oxygen, which loves to steal electrons from stable molecules, and a metal or calcium atom. When oxygen approaches a molecule, it tries to steal the molecule's electron. This does not happen readily if oxygen is all by itself. However, if an electron-conducting metal or calcium atom is nearby, the metal or calcium will act as a catalyst to strip off the electron from the stable molecule. Now, the oxygen is an unstable free radical with an extra electron, and the molecule has also become an unstable free radical. Inside the body, if calcium or metals such as lead or iron begin to accumulate in cells, the cells suffer massive amounts of free radical damage or oxidation, eventually resulting in diseases of the aging process. This is because metals and calcium are free radical catalysts. One way we can help to reduce free radical damage or oxidation inside our bodies is to consume adequate quantities of antioxidants. Eating lots of fruits and vegetables, as well as taking supplements such as vitamin C, vitamin E, grapeseed extract, or ginkgo biloba are all ways to increase our intake of antioxidants. Antioxidants are molecules with electrons to spare. When an antioxidant encounters a free radical, it donates an electron to the free radical, turning it back into a stable molecule. Scientists actually refer to antioxidants as free radical scavengers. However, antioxidants cannot remove the source of free radicals. In our modern industrialized world, the major source of excessive free radicals in the human body are environmentally derived toxins such as lead, arsenic, mercury, and aluminum, as well as abnormal deposits of calcium within cells. Thus, to diminish the source of excessive free radicals, metals and abnormal deposits of calcium must be cleansed from the body using techniques like chelation therapy. Chelation comes from the Greek word chelios, which means a claw. This cartoon crab represents EDTA, our chelation molecule. EDTA works because of its strong negative electronic charge. Metal or calcium atoms, on the other hand, all have a very strong positive charge. Thus, EDTA acts as a powerful magnet. It attracts and removes calcium or metal atoms that are polluting the membranes of the cells. EDTA cleanses pollution from the body, then leaves the body through the kidneys as a waste material. Within 24 hours, all of the EDTA has left the body, carrying with it a significant amount of waste materials that were polluting the body with damaging free radicals. The cells are then left in a cleaner, healthier state and are then able to heal themselves from the effects of free radical damage. Atherosclerosis, or hardening of the arteries, is the cause of death for 50% of our population. In fact, 80% of us will eventually suffer from some manifestation of atherosclerosis. Heart attack, stroke, blocked leg arteries, and a host of other problems are all caused by this disorder. Most of us have been led to believe that atherosclerosis is simply the result of high cholesterol, which then deposits on the inside of the arteries. there is actually much more to atherosclerosis than simply high cholesterol. In actual fact, atherosclerosis is a complex process caused primarily by free radical damage. The artery is lined by a leak-proof layer, designed to prevent cholesterol or other foreign material from invading the deeper layers of the artery wall. If this leak-proof lining is damaged by free radicals, cholesterol, calcium, iron, and other toxic substances can begin to invade the arterial wall, which causes a further increase in free radical damage. White blood cells then gather in and around this area of damage and cause inflammation in the wall of the artery. Eventually, the inflamed artery wall becomes thickened with scar tissue, cholesterol, calcium, and iron. This thickened region is now called a plaque. If the plaque becomes thick enough, blood flow through the artery is impaired. This blockage of blood flow can lead to chest pain, known as angina, or pain in the legs with walking, known as claudication. In addition to causing stable blockages, the plaque can become dangerously unstable. Without warning, the brittle and unstable plaque may rupture, leading to sudden clot formation. This is how unexpected heart attacks often occur. This microscopic picture is a cross-section through an actual coronary artery in a region of the heart where plaque rupture caused sudden cardiac death. This area, which was the opening where blood flowed, is now completely blocked with a large clot. Around the outside of the clot are small bits of calcium, which was part of the calcified and unstable plaque. Prior to its rupture, this plaque was only blocking the artery by about 50%. This would not have been enough of a blockage to cause any symptoms at all. One day, without warning, the plaque suddenly ruptured. Its contents spilled out through this opening, and the plaque's calcified shell exploded against the side of the artery. The debris from the inside of the plaque stimulated this large clot to form. This person was probably well and without any symptoms such as angina, until suddenly this small plaque ruptured, leading to death within minutes. If this same phenomena occurred to a plaque in the neck arteries, a piece of the plaque would likely travel into the brain, lodging there and causing a stroke. With each chelation treatment, free radical generating metal ions, such as iron, are cleansed from the bloodstream and cells of the artery wall. Thus, the amount of damaging free radicals are greatly diminished, and the healing process is able to take place in the injured arterial wall. Calcium is gradually dissolved and chelated away from the hardened atherosclerotic plaques. Hardened arteries regain flexibility, and blood flow begins to improve. Those plaques which are very brittle, rough, or ulcerated are gradually softened, and the risk of the plaque fracturing and releasing bits of debris is greatly reduced. Likewise, the risk of a plaque rupturing and forming a potentially fatal clot is also significantly diminished. With each chelation treatment, high amounts of B vitamins are given intravenously. This improves cellular metabolism and reduces the production of a toxic substance known as homocysteine, which is a major risk factor in the development of atherosclerosis. As well, B vitamins such as thiamine increase the excretion of toxic metals. High amounts of vitamin C are given intravenously. This helps to rapidly raise tissue levels of vitamin C, resulting in improved healing and powerful antioxidant effects. High doses of magnesium relax the arterial wall, strengthen the heart muscle, and help to diminish irregular heartbeats. Many people are actually magnesium deficient, and in such cases, intravenous magnesium can have numerous benefits. In addition to the direct benefits of chelation therapy, antioxidants and mineral supplements are prescribed in association with chelation therapy. These provide additional free radical protection to the cells of the artery wall. In 1993, a group of researchers headed by Dr. L.T. Chappell published a critical analysis of all research on chelation therapy as a treatment for arterial disease. Using a time-honored method of statistical inquiry known as meta-analysis, a complete investigation of 18 exceptional scientific studies was done. The results of this study, which involved a total of 22,500 patients, confirmed that chelation therapy has a good to excellent success rate in 87% of those with blocked arteries. Chelation therapy is gaining worldwide acceptance and is becoming standard medical treatment in many countries. Although still suppressed and opposed by those who have little interest in advancing beyond the established and very profitable approaches to circulatory disorders, increasing numbers of physicians and scientists are coming to the conclusion that chelation therapy has tremendous potential in the treatment of atherosclerosis and many other disorders. An excellent example of this increased acceptance is seen in the recent publication within a major cardiology textbook of a chapter dedicated to EDTA chelation therapy. This text, entitled Cardiovascular Drug Therapy, is the second edition edited by Dr. F.H. Meserly. This text is considered to be one of the most authoritative references in the field of cardiology, and it has been written by over 280 of the world's top cardiologists and cardiac scientists. Because of this book's extensive editorial review board, nothing gets into this text unless it is based on the best science the world has to offer. Because EDTA chelation therapy now fits so squarely into the scientific understanding of atherosclerosis, a chapter on EDTA chelation therapy was printed in this latest edition. Written by the renowned scientist Dr. Martin Rubin, Emeritus Professor at Georgetown University School of Medicine in Washington, D.C., this chapter describes in very clear terms that EDTA chelation therapy is a scientific and rational treatment for circulatory disorders. Dr. Rubin goes on to describe how EDTA chelation is safe and effective as a means to greatly reduce free radicals in the body, to reduce the risk of blood clots, and to bring about a decalcification of atherosclerosis. His own research using the ultrafast CT or cardiac calcium scan has demonstrated that patients with severe coronary artery disease show a marked lessening of coronary atherosclerosis following a series of EDTA chelation